There's concern rising over new outbreaks of measles here in the United States. Between 2020 and 2023, there were a total of 242 measles cases in the U.S. But there have been almost that many this year alone. At least 13 states, including Florida, reported a case. One of the latest, a person in Maryland who recently traveled abroad. Our Julie Solomon spoke to local health experts who are now concerned about the cases.
With spring and summer travel season approaching, the CDC is urging people to check their destinations for measles cases and also asking healthcare providers to share information related to vaccination guidance.
Yes, we do see sporadic cases of measles here and there in the U.S. every year, but an outbreak is a different story.
The CDC has reported outbreaks in Texas and New Mexico, with 2 deaths reported, 1 in each state. Florida reported its first case of measles in a high school student in Miami last week. Dr. Jill Roberts, an associate professor with USF College of Public Health, worries about our population losing herd immunity.
If we don't have 95% of vaccination rates, we lose herd immunity. So many communities have lost herd immunity. We looked up the numbers in Miami the other day when that case was occurred. It was only 91% coverage. So they've lost herd immunity in Miami.
The virus can remain in the air for 2 hours after an infected person has left. Symptoms include high fever, red, watery eyes, cough, and a runny nose. A rash appears 3 to 5 days after the first symptoms. The Florida Department of Health says those who receive the full series of the MMR vaccine are 98% protected and unlikely to contract measles. The Florida DOH says if 10 individuals without immunity come in contact with measles, up to 9 of them will contract the disease.
And I'm very worried we're getting to that point very quickly where we're going to run out of options to stop this if we don't get more vaccines out there.
Julie Solomon, ABC Action News.